Evolent Health going public on the New York Stock Exchange today. I'm with the CEO, Frank Williams. Nice to see you here.
Thank you. It's great to be here.
Yes, congratulations on the IPO. Early on, your stock is doing quite well. You've had a very strong success story before you went public. Huge amount of revenue growth. Tell me what your company is doing different and your growth projections going forward.
Yeah, if you think about healthcare in the United States, it costs too much and we're not getting value from the dollar that we're spending. So we're really working with providers that want to change the model and really keep people out of the hospital, try to make chronic patients healthier. And so we're providing technology, knowledge, people to work with the leading healthcare providers and really work towards a new model of care.
And would you describe yourself primarily as a software company or a knowledge company?
I think it's both. In healthcare, what we've learned is technology itself is not going to transform the system. People actually need technology knowledge, they need expertise, and we're trying to bring all those things together to really help them transform their businesses.
What's your outlook for revenue growth?
Well, in the first couple of years, we've grown to over 100 million in revenue. We see a giant market, a $50 billion market opportunity, and we've committed to a minimum 30% growth rate long term.
And are you working now with some major companies in the U.S.?
Yeah, we're working with some of the leading health systems in the United States. If you think about MedStar Health, IU Health in Indianapolis, Vanderbilt in Tennessee, it is the who's who of American healthcare, and we're in about 20 markets today. We obviously want to drive results there, really prove the model, and we're continuing to open up new markets across the country.
So let's do a real life example. I go into my doctor with a sprained ankle. How does your system help my doctor and me?
Well, a lot of times your doctor will only have 5 minutes with you because they're seeing 30 patients a day. And for a lot of conditions, you need more support than that. Maybe you need to understand how you should take your medications. Maybe you're going to physical therapy and you want someone to follow up and make sure that you're actually doing your regimen at home. So it's how do we build an integrated care team around the physician that can support you once you leave the doctor's office and hopefully avoid that sprained ankle again.
Are you hiring?
Yes, we are hiring. In a short period of time, we have a staff of about 850 people today. We're growing and we're hiring in almost all areas of the company.
What's the biggest challenge that you think you're going to face as a public company?
Well, as a public company, we obviously commit to growth and we have to perform. So it's what we do for a living, and we're set out to execute and continue to generate results, but we're pretty confident in where we are and we believe in what we're doing.
Frank Williams, great to talk to you. Thank you so much.
Thank you very much.